still on respiratory infections. But in today's episode, I will be telling us how to treat these infections in our child or children. Previously, I talked about how these infections can be prevented, but it is also safe to know how to treat or manage these symptoms if it happens. Because, of course, we are humans and anything is bound to happen, isn't it? Good. What you should know is that most of these respiratory infections are like flu, colds, RSV are caused by viruses. That is why it looks like your child doesn't get better when you start bombarding him or her with antibiotics when they have respiratory infections. This is because most of these infections are caused by virus and not bacteria. So you can never ever treat viruses with antibiotics. Just note that. So these respiratory infections mostly come with symptoms like runny nose, nasal congestion, sore throat, fever, and a lot more. So, the treatment of respiratory infections in children that I will be talking about, which is our main topic in this video, we'll be focusing solely on how to relieve these symptoms in your child to prevent it from getting worse. Because one good thing about respiratory infections like colds and flu is that children get over it with time. These infections sometimes they last for days or weeks. While you're waiting for the child to get better, it's also good you help relieve the symptoms because these are children, they are babies. So you try as much as you can to relieve these symptoms to prevent it from getting worse. The first on how to treat respiratory infection in your child is one, hydrating that child. Hydration. And you do it by making sure your child take enough clear room temperature fluid, which is mostly water. Try as much as possible to make sure your child take enough water, enough fluid. Clear, it should be clear, it should be room temperature. Don't make it too cold or too hot. It should just be normal temperature, room temperature. The second is to make sure, try as much as possible to ensure your child gets enough rest while they are going through the symptoms of respiratory infections. Just try. Sometimes it's always difficult, but if you can, make sure, just try as much as you can to ensure the child gets enough rest. Like I said earlier, one of the symptoms, which is runny nose and nasal congestion. For you to manage that, to make sure your child, your infant's nose is clear from mucus. Okay? Sometimes it's always difficult blowing the child's nose. There is something we call the bulb syringe. It's a rubber bulb suction device, okay, for infants that cannot blow their nose. You can use that rubber bulb suction device to suck the mucus out from the child's nose. So, in managing that runny nose, that nasal congestion, you can use this in your infant or any other child that cannot be able to blow out the mucus or cough it out. Use it and make sure the child's nose is clear from secretions. The fourth on the list is about you making breathing easier for your child. Because with these symptoms, sleeping or even resting is always difficult for these children. So what do? You might want to use pillow or any other soft material that can just help. If the baby's bed, the child's bed is tiltable, you can just tilt it a little bit high. If you don't want to use the pillow to prevent suffocation or anything in the child, just to be safe, you can tilt it with any other thing that will help the child in breathing. Another way to also treat or to manage these symptoms in your child is to make sure that the air in your child's room is not dry. How do you do this? You run cool mist humidifier in your child's room. By so doing, the air will be moist and it will help breathing for your child. Because when the air is dry, it irritates the nose. So you making the air moist is also a way of helping your child's breathing. So that is another beautiful way of managing these symptoms while the child gets better. And another is to make sure, try as much as possible that the place your child is, it could be the room, even the house, is free from smoke. This also entails you making sure that nobody smokes around the child while the child gets better. The last but not the least is on how to treat fever, because definitely Fever is one of the major symptoms that comes with respiratory infections. So what you should note, like I've made in my other video, is that in treating fever in your child, please do not use aspirin. Acetaminophen or ibuprofen is good. To know the reason behind this, I will be attaching the video where I said something about this. You might want to go back and watch the video. It will give you a clear picture of why I insist that you don't treat your child's fever with aspirin. Okay? Like I said earlier, infants, children get over some respiratory infections like colds and flu on their own in time with enough rest and care. But if you notice the symptoms are getting worse, they are getting worse, and your child is beginning to show some of the signs I am going to be talking about in my next video. If you notice that child start giving that signs, please and please do not hesitate to go see the doctor for proper treatment and diagnosis. I'll see you in my next video. But until then, do not forget to share, like, and comment. Do take good care of yourself. I will see you again. Bye.